Oh, there we go. We are live. Well, I was waiting for a countdown. Hopefully, the audience got to enjoy the countdown. That's fun. Gets you amped up. But we're excited. We're going to have a great discussion today. My name is Doug Kellogg. I'm State Projects Director with Americans for Tax Reform. And one of the issue areas we work on is improving the criminal justice system, making sure that the significant taxpayer resources that we spend on criminal justice keep folks safe, but also the system is efficient and effective, and we aren't just wasting resources putting people away for stuff that isn't smart. So on that front, we do a lot of work on drug policy reform, and we have a very special guest today, Christina Dent with End It for Good. Christina comes to this from a very personal perspective, personal experience, and started a very interesting organization to help improve drug policy around the country and at the state level. And so we're very thrilled to welcome Christine to the podcast. Thanks for joining us.
Thanks for having me, Doug. I'm excited to be with you guys.
No, it's great to have you. And let's start with that personal experience. I think, we can talk a lot about different policies, but, what this comes down to is how policy impacts the lives of people on the ground. We want people to be safe. We want them to be healthy. We want the justice system to protect us, but also not just completely ruin people's lives if we have overly onerous laws, too many laws. So tell us how you got involved with End It for Good, how you started the organization. I guess probably before that, what brought you to just be interested in this issue area?
Yeah. So you're right. I think where we maybe a lot of times drop the ball is that it feels like boring policy, and we don't really see how policy trickles down into the lives of real people. For me, that was seeing how it trickled down into the lives of children and families. So I'm born and raised Mississippian. I've lived here my whole life. Was homeschooled kindergarten through 12th grade back in the early days of homeschooling, back in the 1980s, kind of one of the first frontier. I went to a Christian university. I have a degree in Bible, never used drugs. So for me, I come to this issue as somebody who supported tough on crime policies, tough on drugs, anything that sounded like it could potentially make my world safer was something that sounded great to me. And it didn't impact me personally. And so I never put any thought really into, what is the real life outcomes of this until we became foster parents. That was about 8 years ago. My husband and I became foster parents. And that was the first time that I came face to face with somebody who was struggling with a drug addiction, and came face to face with the impact of the criminal justice system on families. And that experience started for me with a woman named Joanne. And she had been using drugs, illegal drugs, for about 20 years. I mean, it had been since she was an early, like 13, 14, got introduced, and was using all sorts of different things at the time that I met her. It was currently methamphetamine that she was using and struggling with an addiction with. And because she had used while she was pregnant, was not able to beat that addiction during her pregnancy. Her child was automatically removed from her custody and put in the foster care system after he was born. And so straight from the hospital after he was released, after he was born, he was taken by a social worker and he was brought to my house, and we became his foster family. And I could not fathom how a mother who loved her child could use drugs while she was pregnant. I had no category for that in my mind. And so to me, the way that worked out was, well, then she must not love her child. This must not be important to her. So certainly her child is better off with me, not with her, because I would never do that. I'm thinking to myself. So I take Beckham, her son, for his first visit with his mom at the local child welfare office just a couple of days after he came to live with us in foster care. And I pulled into the parking lot, and I had not met Joanne before, popped his car seat out of my car and turned around, and there is this woman running across the parking lot, just sprinting towards me, and she's weeping. And she runs over and she starts kissing this tiny little baby in this car seat that I'm carrying. And I'm standing there awkwardly wondering what on earth is happening, because I don't have any category for this. And so my natural defenses go up, and I think, this isn't real. This can't be real. No mother who loves their child with this kind of display of affection could possibly use drugs while they were pregnant. That doesn't make any sense. So this must be maybe a show. Maybe she's trying to get me to put a good word in with the social worker, or it was super confusing. And so my knee-jerk reaction was suspicion. Because to think otherwise really was a really challenging thing. That would require me to rethink something I had thought my whole life, and humans don't like to do that. So I'm going to push it back on her and say this is something with her that's probably the problem here. So she spent her 1 hour of allotted time with her son, visiting him, and I took him back to my house after that. She went to inpatient drug treatment in another part of the state, and she would call me every day, and she would ask me to put her on speakerphone, and she would sing to her son over the phone. And I have this like burned in my memory picture of standing in my kitchen, holding my phone on speakerphone while her son is sleeping in his little bouncy seat in my kitchen. And she's just singing "Jesus Loves Me" to him over the phone. And the more that I got to know Joanne, the more it was kind of this collision course with reality, which is she is a mom like me. She really does love her son as much as I love my 3 sons. And her addiction is a really complex health crisis, certainly not healthy, certainly not good for a child. But it's not a lack of love for her son, a lack of a desire to be a good mom, a lack of desire to be there for him and raise him, or a desire to be free from that addiction. I could kind of pull those things apart, and I had always seen them kind of all as one thing. Like, people with an addiction are bad people doing bad things. And I was beginning to have that reshape to see people with an addiction are hurting people trying to feel better, maybe in a really harmful way. But the core issue there is not one of, they are a particularly worse person than I am, but rather they are medicating something, self-medicating something, maybe that's really painful. Could be childhood trauma. It could be loneliness. It could be isolation. Could be any number of things that people experience as part of living in a world that is deeply broken, where we have a lot of pain in our lives. And so that kind of collision for me, I could not just stay at, well, for her, I can change my mind. I've always been someone who's very curious. I love to learn. And I felt like, you know what? I'm engaged in foster care because I care about children and families. And this is like heavy input for my family, for my own emotional state to be a foster parent. And I can see here, if we're doing anything wrong on how we handle drugs and addiction, the impact is on a massive scale. Like, I can see that. I know that we're putting people like Joanne in prison every day for the same thing that she's struggling with. And if I can see now that that's not going to help her address her addiction, but it will destroy this family, what does that mean for all of these other people that we are putting in prison? And so that kind of set me on this journey to learn. And I couldn't just leave it there. I really wanted to know, is there something different we could do that would get better outcomes? You should never make policy based on a personal experience. So, I need research and evidence showing, is there something different we could do with drugs and drug use and addiction that would get us the outcomes we're really after, rather than collateral damage of children and families paying the price for policies that may not be the best for what we really want.
Absolutely. Well, it's a great story. It's very moving. There are 2 issues there. One is we cannot incarcerate people if they're really not posing a threat to somebody else other than themselves. If it's just possession and use, that's sort of one step. But then there's, okay, but like you said, it was a complex situation. There's a lot of things driving this issue. So that doesn't fix the bigger problem for this person, which is how do you address the addiction? And how does, again, part of this also, how is government supposed to fix that versus family, community, other support? So in that range, where do you see solutions? After that experience, how did you start to come up with some ideas about how to actually fix the addiction side of this?
Yeah, so I kind of got interested on it on the consumer side. How are we handling people who use drugs? Um, and I ended up that helped me to understand a lot about drug use and the impetus for drug use, that people are trying to feel better than they do right now, which then makes sense why making them feel worse than they do right now has not been particularly effective at handling drug use and addiction. So we're kind of saying, somebody is using a drug that's making them feel better, and let's try to make their life really, really painful and see if that will make them to stop trying to feel better. So it's kind of like we're using sort of the worst possible tool to try to address a problem, because we're using trauma. The criminal justice system is designed to be a very traumatic experience in someone's life. We're using trauma to address a problem that is often driven by a desire to self-medicate trauma that they have experienced previously. So we're kind of using trauma to try to get rid of a problem that's made worse by trauma. And it's then understandable why this has not had the best outcomes that we want. So I think on the government front, it's so important to realize that you cannot force someone to stop using a substance, no matter how badly you want to. And I think millions of families across America could say, we have tried everything. We have tried cutting off. We have tried shaming and blaming. We have tried leaving them in jail. We've tried getting them out of jail. We've tried everything to force our family members to stop using drugs. And the reality is that you cannot force someone to stop using. What you can do is help them access the things that we know help people exit addiction, which is employment, housing, community, family relationships, purpose, a reason to wake up in the morning. All of these things are the things that we absolutely know help people exit addiction. Now, that doesn't mean that if they have access to those, that addiction is going to be over tomorrow. Sometimes it's a process of multiple years before people's lives get to the point where they can begin non-problematically using, or they're willing to stop using altogether. But for me, so I got interested on that consumer level of, okay, no matter how much we wish that we could sort of force people into this, into a choice, that hasn't worked. And there's a reason for that. It just doesn't work. But also there's this other piece of, criminalizing markets. And what does that do to pushing a massive hundreds of $billion-a year industry underground? Funds gangs and cartels and terrorist organizations by putting billions of dollars into their coffers rather than into legal regulated businesses. And that was the first time that I really thought about, oh, wait a second, we are creating crime. We are financially incentivizing crime by allowing this massive industry to operate underground rather than allowing it to operate legally. And that was really what kind of changed my mind. So I kind of got changed on multiple fronts of wanting to approach consumers through health-centered solutions, not criminal justice solutions. And then approaching the kind of market side through, if we allow substances to be sold in legal, regulated ways, different ways for different substances, depending on their potential for harm, that would massively decrease the amount of crime that we have. And it would also help with the overdose crisis that we have right now. We have record numbers of overdoses in America. We hit over 100,000 people who died in 2021 of a drug overdose. The vast majority of those overdoses are coming from contaminated drugs that people bought on the street, and they don't know what's in it. It's laced with fentanyl or, something else that's out there on the street. There's any number of things people lace drugs with. And users have no idea, is the baggie they bought enough that's going to get them high, or is it going to kill them? And there's no labeling, there's no appropriate dosing. And so that, on that, it was a little easier to get on board with handling consumers in a health-centered way that would really use evidence-based solutions to help them exit addiction when they're able to do that. But on the market side, that's a little tougher cell, that really felt like the earthquake for me of like, oh no, this is, I remember when California legalized medical marijuana in the 90s, and, I was 12 or so then, and thinking, this is like, what a godforsaken land. I'm so glad I live in Mississippi rather than like California, because it must be terrible over there. And yet now I've ended up changing my mind, not because I want people using drugs, but because the cost, the human cost, the cost of public safety, the cost to life is so great under prohibition that I ended up kind of backing into where I am now, which is wanting to see markets moved back, legal and regulated, consumers treated as, regular citizens if they're not harming anyone. And if they have an addiction, that would be handled in a health-centered way when they're ready to address that. And that, for me, that's not a perfect solution. I think if we can all agree that there's no perfect solution out there, I think shifting to a more realistic solution than what we have had over the last, 50 to 100 years, where we can say, you know what, drugs are going to be with us. They've been with us since the beginning of human history. People like to change the way that they feel. And we can handle them in a way that decreases the most harm, whether that's crime, overdose deaths, disease, incarceration that's not necessarily necessary or helping public safety. And that's kind of where I ended up. That I'm not looking for a perfect solution anymore. I want a realistic solution that can decrease harm and help more people like Joanne and Beckham and other families like them, and other families who live in high crime areas have better lives than they have right now under that kind of weight of the impact of prohibition.
So where do we move the line then, in your opinion? We have some, I would say, not great looking situations in cities like San Francisco. You have like open air drug use and this kind of stuff, which just decreases public safety. Citizens don't seem to enjoy that. It doesn't seem healthy for the people using. I mean, there's a difference between your vision and sort of that kind of vision, I'm imagining.
Yeah. So I think it seems to me what has happened in some places has been sort of a general moving away from arrest for anything. And we would draw a clear line between what we're talking about as possessing a substance or participating in a legal market and following the laws. And then, other crimes that do actually harm other people or do impact public safety. So, if you go and steal something, that's a crime of theft. There's a victim there you should be arrested for that. That's not something that's going to help the public just to say, well, that's just not really, that big of a deal. So we would draw a clearer line than I think maybe some other drug policy organizations even would draw, to say, no, we're making a distinction between, we're not just saying all crime is not a big deal. We're saying, should possession be a crime? We would say no. Should participating in a legal market be a crime? No. And maybe we should expand some of those legal markets to decrease the amount of crime from the illegal market. And yet, if you commit assault against someone, whether you are high or drunk or sober, you should be arrested for that. You should pay whatever the appropriate penalty is for that. And even for crimes where, a lot of people would say, well, what about drug courts, where we arrest people for possession, but they have the opportunity to rebuild their lives. To me, drug courts seem like a perfect opportunity for something like, let's say it was a theft where somebody was addicted to drugs, trying to get enough money to feed that addiction. And they went and stole, whatever, your lawnmower, and went to the pawn shop and pawned it. Well, we could just put them in jail for the amount of time that theft allows for. Or we could say, the reason they are committing theft is not because they just happen to be somebody who's a career thief, but they have this drug addiction and they're going to feed that one way or another. And so over the course of a drug court, they have an opportunity to make the restitution for the crime. They are participating in the criminal justice system in a way that is making sure that they're doing what they need to do related to that crime, but they're also addressing that underlying issue of that drug addiction. Because if they only spend a couple of months in jail for stealing your lawnmower, and then they go back out on the street again, well, that addiction hasn't changed. And now they're just going to go steal somebody else's lawnmower because they're still dealing with that addiction. And drugs are readily available in jails and prisons. That's just been that way. We can't keep them out of jails and prisons. And we continue to try to keep them out of the free world, but they're everywhere. Anywhere there's a market, anywhere there's demand, there's always going to be supply for those. So I think there's a way to do drug policy that does not end up looking like everyone just does whatever they want to, but rather says, no, we're going to keep some clear lines, but maybe those lines need to move a little bit from where they are right now.
Yeah, and one important principle is detaining somebody when they start to pose a threat to themselves, even if it's just use. Having no consequence can just end up leading to overdoses and deaths, so it's not even helpful for them. And also, can you just quickly explain what you mean by drug courts? I think we're familiar with that, but maybe not everybody watching.
Yeah. So drug courts have come into use much more in recent years. And the way that it works is if you get arrested for, let's say you get arrested for shoplifting, and maybe that was for you were shoplifting because you were trying to feed an addiction. A judge can sentence you. You have to generally are pleading guilty to whatever crime, but the judge can sentence you to drug court. And so you, here in Mississippi, it's often 3 years you participate, and that can include weekly random drug testing. You generally have to go to court. The different courts do different amounts, every 2 weeks, maybe check in with the judge. You have to be there at a certain time. You might have to go to a certain number of meetings of, if it's an addiction that you're fighting, they might say, well, part of your drug court plan is that you have to attend a certain number of, Alcoholics Anonymous meetings or some other type of meeting. You may have to do it. It can include all sorts of different things based on whatever your unique situation is. But if you complete it at the end of that 3 years, sometimes what they'll do is allow you to expunge or to at least not serve the prison time that was associated with the charge that you got. So it's a way of holding people accountable without actually incarcerating them during that time. Now, sometimes, if you fail a drug test or you miss a court date or something like that, some judges will say, well, you got to spend, 2 days in prison as kind of your slap on the wrist for that. But in a lot of situations, it can be a helpful piece. So we would say we'd love to see that not used for drug possession, but for other crimes where there are victims where maybe an addiction is the real issue, because it allows people an opportunity to address that addiction in a way that's actually going to help public safety right now and going forward, and actually stop that cycle of harm to the community rather than just continuing it.
Yeah, and I think on the law enforcement side of this, I think there's an understanding for people who run jails that addiction not being addressed just means that people are serving a term, even if they're held, they're going to get released at some point, especially for lower level offenses. And then if they still have an addiction problem, they're just going to end up back there because the thing that's driving their crime is not being cut off.
Right.
So do you find there's opportunities for compromise with law enforcement and DAs and the jail systems? Is there opportunity to come up with compromise legislation and policies? Is there sort of a confrontational relationship there? What's your experience?
No, our experience in Mississippi is we have done a lot of outreach with law enforcement, with judges, with prosecutors, inviting them to events that we hold all over the state. And our experience has been that, sometimes they come and sometimes they don't. But we've had probably just last year, we presented our kind of case for changing the way we approach drugs to over 100 law enforcement officers in various venues. And it's interesting, it tends to be that the longer someone has been an officer, the more quickly they are to say, we've seen what you're talking about, because they've arrested the same people over and over again. They've seen this kind of cyclical pattern with people of like, oh, here they are again. Here I am arresting the same person again. And it hasn't fixed the problem. Now they can't get a job because they've got a criminal record. And so they've seen this cycle of harm happening. My experience has been a lot of just sort of your regular law enforcement officers. If you ask them personally what they think about, let's say, marijuana legalization in particular, a lot of them are personally supportive of it, even though their profession tends not to be supportive of it. And so, but it's not a profession where you get to sort of publicly say what you think. It operates much more as you defer to the people who are in command to give public opinion on those kinds of things. But we found a lot of officers who want to see change. They're on some continuum of maybe just sentencing reform, maybe marijuana legalization, but a lot of them are willing to see reform. I'll tell you, there's two stories I think are illustrative of this. So we had a sheriff who came to one of our events. He's a sheriff now in Mississippi. And he said, he came up to me afterwards and he said, I've been a law enforcement officer for 40 years. And I can tell you from my experience, marijuana is not a gateway drug, but the prosecution of marijuana is a gateway to a destroyed life. Now, this is not a progressive sheriff. This is somebody who's a conservative sheriff in a conservative community. And he's just seen this. This has been his professional experience watching this happen, that it just does not help public safety. We did another event and we had about 100 people there. And we had several sheriffs that came to that. And one of them stood up and he said, so we do a 30-minute presentation, then we allow the audience who's come to have a minute each to give their feedback to it. They can say, I totally disagree, or I agree, or whatever they want to. And he said, so he's the sheriff in the community we're in. And he said, my officers stand ready to make any changes that the community wants to see, because I've seen that what we're doing doesn't work. And we are ready whenever the community is ready to make changes that would get us better outcomes. And the other sheriff came a few minutes later and he said, my experience is exactly the same as the other sheriffs. I've been in this for decades. I've seen that it doesn't work. We continue to arrest the same people over and over again. We're ready for a different approach. Now, they might be incrementally ready for a different approach, but that's okay. That means there's to work.
We're losing Christina a little bit there. Hopefully she can hear us okay. So if you pop back on, Christina, we sort of lost you. But we are getting close to the 2:30 stop time, so we may have to wind down. Are you there, Christina?
There we are. Yep.
Okay, there you're back. All right, we'll have to have some internet reform. There
you go.
But no, you were saying that sheriffs are ready for some incremental change, but potentially.
Yeah.
But I think that's really, when we're, especially from a conservative perspective, public safety and having flexibility if there are bad public safety outcomes is important. I think what's done a lot of damage in this area is overly ideological DAs, especially in cities where there's a lot of prominent cities, and they're completely inflexible. Results are bad, and rather than shifting and making a change to try to get things back under control, they just kind of dig their heels in and do nothing. So I think that's done a lot of damage to any kind of policy change, when on an individual level, you probably find a lot of agreement for addressing some of these areas in the criminal justice system and improving it. But the inflexibility and overly ideological, high profile prosecutor situation, not helpful. So, but it's good to hear, which I think is something that I've experienced as well in here from folks when we do talk to law enforcement, sheriffs, people who run a jail system. It's, the status quo is not working. So you have to move forward carefully. And I think voters and the public needs to have confidence that public safety is going to be the priority, and it's not going to be ignored if there's a problem.
Right.
But there are some smart policies that over time will improve public safety.
Yep.
And that's the ultimate goal. And there just has to be trust there to pursue this. Otherwise, you can't really get into the starting blocks. So, if anybody has a quick question to throw on a Facebook, let us know, or YouTube. I think we got YouTube too. Let us know, and we'll ask it. Otherwise, we'll give Christina the last word here. And thank you again for joining us today. It's been great to talk to you. We really could talk a lot longer about this. You have a lot of experience with this, and then it's a complicated issue area. There's a lot of tracks to go down.
It is, absolutely. I wanted to tell you the end of the Joanne story. So Joanne has been sober now for about 6 years since her son was born. She works full time with other people trying to enter recovery. She works for a treatment center. That's not always the route that happens if people are given an opportunity to rebuild their life, but it could only happen because she is not sitting in prison while her son is growing up without her, and she's a fantastic mother to her son. And so I think that if we look at outcomes versus sort of our visceral reaction, are the outcomes we're getting what we want? And if not, we've got to trace that back to those root causes. Why aren't we getting the outcomes that we want? Why is there so much crime from an underground market? Why are so many people dying of overdoses? Why do we have so many destabilized families and children happening because of incarceration, when we know that children who have had an incarcerated parent are at greater risk of becoming incarcerated one day themselves? That's not conservative. That's not what we want. We don't want to be setting ourselves up for another generation of people to be incarcerated. We want to break that cycle, not incentivize that cycle. And that's what we want to do, is dig deep into those policies and see where can we get better outcomes based on where the harms are coming from.
Absolutely. Well, thank you very much again. And that's a great comment to end things on. We're over our time. So we'll have the audio up on the Apple Podcasts, From the Swamp to the States. And so definitely check out the audio there, atr.org. And thanks again, Christina. Where can folks find End It for Good?
enditforgood.com, and join us on social media. We're all across there. Love to have you join the conversation. Whether or not we agree, come join the journey.
Okay, great. Thank you again. All right. Thanks all.